what's the difference between the urgency and emergency? Yes, great. Hypertensive emergency has end organ damage. If there is no end organ damage, then it's hypertensive urgency. Now, some people move away from the terms of hypertensive urgency. The reason is because when we say hypertensive urgency, it seems as if we urgently needs to do something right away. Actually, no, right? Hypertensive urgency does not require that. So they kind of changed the term. They changed the term to severe asymptomatic hypertension.
Yeah, so as Dr. Haryadi said, hypertensive urgency or crisis or severe asymptomatic hypertension, 180 over 120 without severe features. So in this case with this patient, she was complaining of a headache. There's a lot of controversy over whether you want to lower the BP over hours or over days. Up to Date has many different ideas, but their idea is that like the risk of adverse events like a stroke, or if the blood pressure is lowered too rapidly or at a level below the ability to auto-regulate to maintain tissue perfusion, you got to like weigh the risk and benefits for that. And then on the other side, there's also risk of cardio events if the blood pressure is not reduced in time. So if you do want to lower that acutely to less than 160 over 110, or a better way to look at it, less than 25 to 30% lower than their baseline, they recommend clonidine or captopril.
The most common reason why people get into the severe asymptomatic hypertension because of non-compliant. That's number one. Treatment is just resume their blood pressure medications. You can use the amlodipine, you can use the ACE inhibitor, you can use ARB, you can choose anything. I don't typically choose clonidine. Why? Because remember, severe asymptomatic hypertension usually is non-compliant patients. So if you take clonidine and then you don't, you have a rebound hypertension, right? So you don't want to do the clonidine. I rarely ever give clonidine for this type of patients because of their non-compliant issues.